The month of August recognizes a significant event in many people's lives, the act of breastfeeding. Whether that be a mother supplying or a child receiving, the act is often overlooked or underthought, even though it helps support life for so many. And it is National Breastfeeding Awareness Month, and now we are joined by Micah Jesperson, who is a lactation consultant and registered nurse at Essentia Health. Thank you so much for being here.
Thank you, Jesse, for having me.
Yes, of course. And you know, it's hard enough being a new mother. You know, you
Yeah.
have so many things you have to juggle, and one of the most important maybe things is breastfeeding. So what are some of the supports and resources available for parents who are seeking help or advice at Essentia Health?
Well, I think it really starts off prenatally when they're still pregnant. And we offer a lot of prenatal education courses, and one of them is a breastfeeding class that occurs every month. And so getting educated before they have their baby and knowing what to expect in that way really helps. And so once the baby's born, then the bedside nurse, all the bedside nurses at Essentia Health are trained extensively in how to help you breastfeed. Plus we have a staff of lactation consultants that will help you and see you while you are inpatient before you get discharged. And then after you get discharged, you can follow up with the lactation consultants too for any kind of issues that you might have as well.
Okay, well, you know, breastfeeding's not for everyone, but for those who choose to partake in it, what are some of the benefits of it?
The benefits of breastfeeding I could talk about for hours long. So it happens for both moms and babies. So for babies, it's having that first special breast milk called colostrum in the first few days, and it helps to give them a lot of antibodies passed from mom to baby, and it offers them the correct amount of minerals and vitamins and fats and sugars, especially for their digestive tract and the energy that they need, and it also helps to coat their digestive tract and get it ready for solid food later on. As far as for mom, it helps to decrease the risk of cancer, both ovarian and breastfeeding cancer. It helps to decrease the risk of type 2 diabetes as well.
Yeah, and you talked about the transfer of antibodies. And, you know, we're in this time right now where COVID antibodies is such a prevalent thing. How does that transfer process work when it comes to the COVID antibodies?
The COVID antibodies start in utero is what we've seen. And this pandemic hasn't been going on for terribly long, but from what we see so far, that it starts in utero. With getting the vaccine, we have seen that the antibodies do appear in the placenta afterwards, and possibly even in the baby in utero. And that also happens with moms that have been positive for COVID when they were pregnant. But then when they start breastfeeding, those antibodies are still passed through the breast milk to the baby as well.
Okay. And if any mothers out there or any parents need any information or resources that you mentioned earlier, where can they find that?
They can call the office, the breastfeeding clinic at Essentia Health. The phone number is 218-786-4477. You can call day or night. The lactation consultants are there from 8 to 4 every day, 7 days a week. And if no one is there, even if you call at 3 in the morning and need just to vent your worries, you can call and leave a message, and we'll call you in the morning for that too.
Okay, Micah Jesperson, lactation consultant and registered nurse at Essentia Health. I appreciate and thank you so much for joining us today.
Thank you so much, Jesse.